I don't know about allowed because it's on both sides of the border that non-essential travel is being discussed. It's very concerning what we're seeing in some parts of the U.S., particularly some of the larger southern states where hospitalizations again are dramatically going up. So not just because of testing, but because people are still transmitting widely in the community. And so that's a risk to us. What I can say is that if anybody does go to the U.S. Or outside of the country, we continue to have quarantine orders in place when they come back. And that's to protect our communities here. So if somebody is exposed and they come back to British Columbia, then they'll need to stay in quarantine for 14 days, and we'll support them in doing that. But that's very important so that we don't have a lot of reintroductions into a very fragile balance that we have here in BC that is working for us. Yeah, it's very concerning watching what's going on in Washington. I know they've been doing some really great work there in terms of the public health work, and they are able to locate, they have a couple of quite large outbreaks in processing plants and things. I don't see it as affecting us. We do know that we have people, particularly truckers, who are going back and forth with essential goods across the border, but we have had that for some time, and there is a process that they need to follow to self-monitor. We know that there's measures being taken both when they're in the States and when they come back to make sure that people aren't transmitting and that they're taking the measures to have safe physical distancing and things when they're in the U.S. So they are getting used to it, as we all are learning about how to do that safely. And we have had people who have returned from trucking and others from the U.S. who've had symptoms, who've been tested and have not passed it on to others. So we need to continue to be sure to monitor carefully and to make sure people get tested routinely as needed.
Just to express our appreciation to the federal government for continuing to not allow visitors and their agreements not to allow visitors back and forth. I mean, I think it's just clearly the right decision right now. The evidence in Washington State, in Oregon, in California, in Nevada, in Arizona. I know many, many people visit the United States. They visit some of those places in the course of a normal year. This is not a normal year. And the decisions that have been taken not to allow visitors are important equally. The decisions we've taken on the essential worker side, whether it's in agriculture with temporary foreign workers in British Columbia, have had a very strong impact since the one significant outbreak that happened early on in our pandemic time back in April. The fact that we have isolated people when they've come, temporary foreign workers when they've come, separate from the farms, has made an enormous difference. These measures need to continue. And it's why we've continued to pursue those things and what the difference they've made. Other jurisdictions in Canada have had hundreds of workers sick and where those measures haven't been taken. We have to continue to take these measures. It's a real tribute to our Ministry of Agriculture here in BC, to our public health officials that we've done that in those cases. In the case of travel to the United States, it tells us, unfortunately, and some extraordinary work is being done in Washington State, that we're going to have to, I think, for some time continue to hold the line on the issue of visitors to and from the United States. With that, thank you very much and look forward to seeing you Thursday.